And Victoria is a planner, facilitator, and knowledge translation practitioner. She specializes in the many connections between community planning, health, and well-being. She has 25 years of experience in leadership, project management, partnership development involving communities, schools, and local government settings. She's worked in Ontario, Alberta, and BC. And her passion is working with public health staff, local governments, and a wide range of stakeholders to support building those healthier communities. She has a master's degree in health promotion. She has a PhD in community planning, and she's also former president of Public Health Association of BC. She is currently a program manager at BC Healthy Communities, and she oversees the Plan H program, which provides learning opportunities and resources for intersectoral action in communities. And I think that Victoria's presentation will be especially enlightening around the piece of how to engage communities and how to be more participatory with communities when it comes to intersectoral approaches. So Victoria, with that, I'm going to hand it over to you. And Victoria, you might have to unmute yourself. I think you're still muted. We can't hear you. So I think it's #6 to unmute.
Okay.
There you are.
I got it. Can you hear me?
Yeah, you're all good now. Thank you.
Thanks. I'm just trying to figure out the technology. Okay, so thanks so much for that nice introduction, Dianne, and to Ketan for sort of setting the stage. What's interesting is that we put our slides together separately, and yet they're super consistent with each other, so that's a great thing. So a little bit is what I'm going to say is a little bit repetitive, but I think that that's a good thing, actually. So I'm going to talk about Healthy Communities work in BC as an example of health and all policies on the ground. And for some of you, you can relate to this in your province, but sorry, we're just getting organized here. But we'll see how that, in terms of our experiences of doing this kind of work on the ground. So very quickly, I don't have a huge amount of time, so I'm going to sort of buzz through these slides as fast as I can without being unclear. But I'm going to talk a little bit about who we are at BC Healthy Communities, just so you get a bit of a context, and then provide 2 sets of examples of health and all policies in action, first from healthy city strategies and then housing needs assessments, and talk a little bit more about challenges and potential solutions. Again, very consistent with what Ketan was talking about earlier. So we are BC Healthy Communities Society. We're a set of 12 awesome people who are part of a nonprofit society serving the entire province of British Columbia. We started this in 2005. We are provide services, programs, resources to create healthy, thriving, and resilient communities. We work collectively with local governments mostly, as well as health authority partners, so those public health staff working in health authorities across the province. We are funded in a variety of different ways, and it depends on the program. But the most important thing about our team is that we have a very multi-sectoral team. So in our team of 12 people, we have 4 public health professionals, 2 community planners, a community engagement specialist, a research specialist, a communication specialist, and then I have both a training in both planning and public health. So it's a pretty exciting place to work because there's lots of really awesome conversations and ideas flowing every day. So one of our programs is the Plan H program. This is funded by the BC Ministry of Health. It is a program that is meant to support the work of local governments and health authority staff and other community partners, and to support their work together, to get them connecting with each other and then supporting that collective work. And we do that in lots of different ways. We provide and build resources. We provide funding. We provide direct supports to communities, and we work collectively with our public health partners in health authorities to support the actual on-the-ground work in a variety of places. That's a map of BC you're seeing on the slide, and all those dots are all the different communities across the province that we've worked with in the past. We are doing quite a bit more work with smaller communities and reaching out. We do a lot of traveling all over the province to help support that work. This just gives you some idea. I just had to show you these gorgeous pictures of communities within the province of BC. And many of you, I'm sure, have been there or are from there. So one of the things that I think when to me, I think of this, some of the work that we do is very consistent with health and all policies. And as Ketan mentioned, there's a lot of diversity in terms of how this looks on the ground. So I'm going to give you a couple of examples and see if you can find those commonalities with the general approach that Ketan introduced to us. So the first is healthy city or community strategies. So these are, actually let me just advance the slide. Oops. These are, healthy city strategies are a comprehensive integrated plan that puts health at the top of the agenda. It shows a commitment to health and well-being and ensures that all policies are healthy policies. So they're general overarching plans or strategies that say this is important to us as a local government with our community partners. We, as a municipality or a region or a First Nation, this is important to us as health is important to us. And so we're going to make sure that we work together, we reduce those silos, and we incorporate health into what we're doing. This is very consistent with a health and all policies approach for sure. This is a very common strategy in Europe. The World Health Organization has a Healthy Cities program, and they support the work of healthy cities all over the world. The European network is very well developed, and you'll see if you get a chance to Google World Health Organization Healthy Cities Europe, you'll find a variety of different cities, and many of them have healthy city strategies that you can take a look at. Super fun stuff to learn from. It's a little bit harder to apply in Canada for a variety of reasons, but it's inspiration for us here at BC Healthy Communities for sure. So in terms of understanding that, we are guided as well by that approach and have adapted it for our province, and there's a Canadian Healthy Communities Network as well. So there's 4 preconditions for change in terms of putting together and implementing a healthy city strategy. The first is political commitment, and often, in many cases, in healthy cities initiatives across the world, the mayor and council has to sign a very official declaration that this is the priority, and this is how we're going to put it into place. So that political commitment is very important. Shared vision and understanding, of course, and there's structures and processes that support that change and allow that to happen. As well, there's opportunities for partnership building and networking. So these 4 preconditions for change, very consistent, again, with what Ketan was pointing out, but this is specific to healthy city strategies, so those local government strategies. So we are able to learn from that in Canada, and some cities have actually put that into place. So, just to, one more thing, just in terms of healthy cities processes, there are 10 key components that we're aware of. I won't read those out to you, but you get the gist that it's very, a compelling vision is really important, as well as the structures and the resources to be able to put that into place. And the last is measuring and benchmarking progress and outcomes, which is, as Ketan mentioned, very difficult to do, but very important. So this gives you some idea. This is actually sort of a theoretical model, I guess it is, or an image for the city of Victoria, where I live. But they don't necessarily have a healthy cities strategy, but this is kind of the idea of how all the different components you would put in place, you would connect together with a broad overarching healthy cities strategy. So, so anyways, the different components of the built environment, for instance, transportation, natural environments, healthy housing, all of those would have their own different departments within the city, of course. And the idea is that they would connect together to figure out how their commonalities or how they could work together to achieve this sort of health for all approach. One of the things that's interesting for me on this one is that I wonder, and actually, and I can say more about this later, but I wonder if the actual word health needs to be at the center necessarily. So that's a question for later perhaps, but we are thinking that sometimes the word health takes people in different directions that we don't necessarily want them to go in, like for instance in healthcare, for instance. So we're thinking of it as, okay, can we put equity at the center, for instance? Can we put sustainability at the center? What can we, what sort of framing would work best for people and would connect with sort of the broader political messages that we're hearing from each particular local government. So 2 quick examples, and I can't tell you too much about these, but you're welcome to Google this. This is the City of Vancouver's Healthy City Strategy. It's a few years old now, but really exciting stuff. Around the outside of that circle in the gray is all the specific strategies or initiatives that they have going. So they're trying to find ways to connect already existing work together. What are the common elements? And how did each of those initiatives or programs or strategies help to achieve that overarching goal of a healthy city for all? I actually really recommend Googling that, the Healthy City Strategy, City of Vancouver. Really exciting stuff. Lots of wonderful information on their website to delve into. The City of Kelowna, so this is in my way of demonstrating that it doesn't have to be a big city to do this kind of work. City of Kelowna is a smaller city within the Okanagan region in the interior of BC, and they're also embarking on a healthy city strategy. Those are the key components of the strategy. They're still working through those one at a time, but it gives you some idea of how different cities have framed it a little bit differently. Also great stuff. This is very much a partnership between the City of Kelowna and Interior Health, the regional health authority in that area, and the wonderful partnership that they've developed to move forward together on this. So in Plan H, for the Plan H program, we're trying to encourage the development of these healthy city strategies. But we also want to make sure that it's not just the big cities that have lots of capacity and lots of money who are able to do this. And so we have put forward, over the summer, we put forward a new grant program that we called Community Wellness Strategies. And it provides funding and support to 5 communities across the province to be able to put forward their own strategy. And we got rid of the healthy city language because, of course, many of these are very small places. So we have chosen 5. I can't tell you what they are yet because we don't have permission yet to communicate that broadly. But let me just say that a couple of them are very small places of 500 people or that kind of thing. They're very small places in some cases, and so it is possible to do this kind of thing. It looks different, of course, but it is important to note that it's not just a big city kind of initiative. Okay, so another example in terms of health and all policies is housing needs assessments. This gets a bit more specific. It's not a broad overarching strategy necessarily, but it is important, I think, to think about how within one area of what's happening politically or strategically, you can find a way to incorporate that health lens and equity lens actually too. So housing needs assessment, perhaps some of you have heard of these or are working on these within your own communities. These are reports they're a means for communities to better understand their current and future housing needs. And so they're looking at, what are the gaps in housing supply, where are the things that we need to go in terms of learning more about how to fill those gaps and to better encourage a stronger housing capacity or component for moving forward with that community. In British Columbia, housing is a very big concern for many, many communities, if not most communities across the province. So this is something that's being done in many communities in BC right now. As part of our work in BC Health Communities, we've actually, just to give you an example of how one looks like. We've worked with the Strathcona Community Health Network and those partners you see there, Island Health, Strathcona Regional District, and the City of Campbell River. This is a region on the Vancouver Island in British Columbia. And we work with our consulting partner, Urban Matters, on helping that region to put together a housing needs assessment. So the idea is, to bring a broad set of stakeholders together to help to answer those questions about what are the housing needs, and with the idea that the next step would be to putting a strategy together to help to fill that, to fill those gaps and prepare something that makes sense for the future. So one of the things that we have been working on a lot is trying to understand how to incorporate an equity lens into all of this work. That's super important from a public health perspective, of course, but it's also important from a planning perspective. I think that for me, I'm coming to the realization that it's not, using the word health, as I say, it may not resonate for a lot of different groups within local government. And so, but we're finding that the equity message, and framed in lots of different ways, can actually make a big difference in terms of getting people on side and understanding the importance of this. So what we've determined is that it's important for us to put an equity lens on this kind of work, and this is an example of how that's done. You might recognize part of this graphic from proportionate universalism, which is, the understanding the ways that the needs and capacities of different population groups. It's important to think about that as we move forward in all of our strategies and all of our policy development. And so we try to do that throughout. So the housing needs assessment process is not just about addressing homelessness, for instance. We also have to understand the unique needs of different population groups and incorporate those into it. So when you look at the bottom, you'll see the different types of housing, non-market, temporary, and so on. And so we're trying to use that lens throughout the whole project. So one of the ways we did that is through the community engagement process of an assessment process. So we used a variety of different types of methods, so interviews, informal engagement, and surveys, and so on. And we geared those different methods, community engagement methods, based on the unique needs of those population groups. So that included a lot of time building relationships with service providers in the community. So really spending time on those relationships, going out and physically being with them as opposed to connecting over the phone or through Skype or something like that. Visits to local band offices, visiting spending hours driving to visit small and rural communities in person. That sort of important trust building was really important in terms of this kind of work. And then, as I say, gearing different types of engagement processes to different types of groups within the community. One of the other ways, too, that we've incorporated that equity lens throughout the process is in terms of how the results were portrayed. There is a big report, several hundred pages long apparently, that gives all the data and that kind of thing as the final report for the project. But what's also important is trying to find ways to use visuals and other ways to allow the community to connect with the results of the project and understand where they fit in, to see themselves in it. And so using these types of accessible language and visuals and quotes and information specific to particular communities helps a lot in terms of incorporating that equity lens and allowing for that stronger community engagement. So just very quickly, I'm probably running out of time, in terms of challenges, very consistent with Ketan was saying, of course. How I put together this is that we actually got our team together for a bit of a brainstorm last week, and we didn't have the literature with us or anything like that. We just sat down with a whiteboard and a bunch of people and said, okay, what are the key challenges that we're coming up against? And it's, lo and behold, they're very consistent with what Ketan was saying. So that's great to see. But first of all, relationships. Again, this is the most important thing. Taking the time, the energy, using those resources to to develop those relationships is so important. Without that, you have very little, actually. And really trying to understand each other in terms of different sectors. Putting yourself in the shoes of people from other sectors and really listening a lot in terms of what do they value, where are they coming from, how are they framing things, what words are they using. That sort of process is absolutely vital, and you can't rush it. Understanding politics. I'm not sure that public health really does a great job in understanding the political nuances and how things work on a in political ways within communities. So we spend a lot of time trying to understand the different political cycles and that kind of thing. We've just had an election, and so how are we going to connect with these newly elected mayors and councillors and so on. So understanding that this work is very political and being able to embrace that as much as possible. Intersectoral collaboration, because we have different planners, public health, community engagement folks on our team, it's easier for us to understand how different sectors see things differently. But again, that's an important part of that collaboration process. Messaging, one of the things about this that I find really interesting is that sometimes for the Healthy Cities area anyways, you see things like sustainable cities or happy cities or smart cities or livable cities. There's a lot of buzzwords out there right now. And so we're trying to figure out, okay, how does health and well-being equity fit into all of that? And how can we use that? So instead of like rejecting some of those terms and saying, oh, no, it has to be about health, we're actually trying to have if you can't beat them, join them kind of approach. And so trying to figure out, okay, what are the co-benefits there? How can we insert where we're going in terms of health and well-being? We don't have to use those words necessarily, but what are the key outcomes that we're looking for that we know could lead to good health and well-being? The sort of communities for all message is actually proving to be quite helpful. And also the co-benefits. It's not just about, in terms of some things around messaging, the co-benefits in terms of economics, it has to be the economic co-benefits for the people who are sitting in the room with you at the time. So the local governments, for instance, don't give a damn about the healthcare savings. They don't care about that. They want to know, how are you going to benefit their budget, through this initiative? And so you have to be able to answer that question. And evaluation, yes, very difficult. We actually have just recently come back from Belfast. Dianne Oickle, our evaluation specialist, just came back from Belfast a couple weeks ago to present our Plan H evaluation plan to the World Health Organization Healthy Cities Conference there, and it was super useful and helpful. One of the things we found was that there's a lot of challenge with evaluation, so I don't think there's any clear set of answers. Okay, Diane's asking me to move it along, so, oops, sorry. Potential solutions, just generally, a lot of the same things I've already said, being flexible, practice patience and perseverance. One of the things that we came up with was relentless incrementalism. In other words, moving forward as much as you can, step by step. It's okay to take small steps. We don't have to do everything all at once. And it's a good idea to look back now and again to see how far you've come. So I think it's suddenly gone. My slides. Okay, there we go. I think I'm done, Diane. I'm just going to... this is the Healthy Communities approach. You're more than welcome to connect with me directly about that. I'd be happy to tell you more about it. But just the general gist is that the balance of those five different strategies is really important in terms of moving forward on this kind of work. So we'd love to hear from you and share ideas. There's my contact information. And there's our website. PlanH.ca is a great set of resources, lots of different stuff on there if you're interested and would like to check it out. Okay, thank you.
That's great. Thank you so much, Victoria. And I will leave this here for a few seconds so people can get to the website. I've had a few questions as you were speaking about whether the slides were available, and whether the webinar will be posted. So there have been so many good resources shared by both you and Ketan, and I want to reassure people that we will be posting the recording of the webinar on the YouTube channel to watch later on, so if people want to use it for ongoing professional development and interest, that would be great. And also the slides should have been sent to everyone this morning before the webinar started, but if you haven't received them, then let myself or Jamie know, and we will send them to a PDF copy of them to you. So with